now with the transition of the auto-injector and the dosing structure, because everything else has been there. You know, the safety's been there, the efficacy, the long-term data is great.
The most common adverse reactions with an incidence greater than or equal to 1% are upper respiratory infections, conjunctivitis, injection site reactions, and eosinophilia. These are not all the side effects. Please keep listening for the full important safety information.
Indication: Adbry injection is indicated for the treatment of moderate to severe atopic dermatitis in patients aged 12 years and older, whose disease is not adequately controlled with topical prescription therapies, or when those therapies are not advisable. Adbry can be used with or without topical corticosteroids. Important safety information. Contraindication. Adbry is contraindicated in patients who have known hypersensitivity to tralokinumab-ldrm or any excipients in Adbry. Warnings and precautions. Hypersensitivity. Hypersensitivity reactions, including anaphylaxis and angioedema, have occurred after administration of Adbry. If a serious hypersensitivity reaction occurs, discontinue Adbry immediately and initiate appropriate therapy. Conjunctivitis and keratitis. Conjunctivitis and keratitis occurred more frequently in atopic dermatitis subjects who received Adbry. Conjunctivitis was the most frequently reported eye disorder. Advise patients to report new onset or worsening eye symptoms to their healthcare provider. Parasitic helminth infections. Treat patients with pre-existing helminth infections before initiating treatment with Adbry. If patients become infected while receiving Adbry and do not respond to anti-helminth treatment, discontinue treatment with Adbry until the infection resolves. Risk of infection with live vaccines. Adbry may alter a patient's immunity and increase the risk of infection following administration of live vaccines. Prior to initiating therapy with Adbry, complete all age-appropriate vaccinations according to current immunization guidelines. Avoid use of live vaccines during treatment with Adbry. Limited data are available regarding co-administration of Adbry with non-live vaccines. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 1%, are upper respiratory infections, conjunctivitis, injection site reactions, and eosinophilia. Use in specific populations. Pregnancy. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to Adbry during pregnancy. Healthcare providers are encouraged to register pregnant patients, or pregnant women may enroll themselves in the registry by calling 1-877-311-8972 or visiting mothertobaby.org/ongoing-study/Adbry-tralokinumab/. There are limited data from the use of Adbry in pregnant women to inform a drug-associated risk of adverse developmental outcomes. Human IgG antibodies are known to cross the placental barrier. Therefore, Adbry may be transmitted from the mother to the developing fetus. Lactation. There are no data on the presence of tralokinumab-ldrm in human milk, the effects on the breastfed infant, or the effects on milk production. Maternal IgG is present in breast milk. The effects of local gastrointestinal exposure and limited systemic exposure to Adbry on the breastfed infant are unknown. Pediatric use. Safety and effectiveness of Adbry have not been established in pediatric patients younger than 12 years of age. Please see full prescribing information.